Hey, my name is Brianna Atkins, and my partner and I are going to talk to you about a viral infection that is devastating to the body. It's really sad what it can do, and it's been around for a very long time, but it isn't very prevalent in the United States anymore. It hasn't been reported in over 30 years, but even though it's not common in the United States, it's still important to study because it's prevalent in other countries, and that disease is polio. Polio was discovered by Michael Underwood in 1789. The first outbreak in the United States was in 1843. Polio is a contagious viral illness that can lead to paralysis and sometimes even death. Even though we call it polio, the correct term is poliomyelitis because polio is just shortened for that. It's of Greek origin and it means gray in marrow, which is referring to the spinal cord. The suffix is itis, meaning inflammation.
Hello, my name is Griffin Potts, and just as Brianna already covered, we will be teaching you about polio. The first subject that I will cover is etiology. Polio is a viral disease just like Ebola and the West Nile virus. Polio is non-enveloped, which means it lacks an outer lipid membrane. Being non-enveloped helps the virus to be more stable. This allows it to survive in a gastric environment and other harsh conditions. This contributes to its easy transmission from host to host. This infection stores its genetic information in RNA form. The causative organism is poliovirus. It is in the Picornaviridae family. All viruses in this family are both icosahedral symmetrical and non-enveloped. The image at the top right corner of the screen is an example of what icosahedral symmetry looks like.
According to the Centers for Disease Control and Prevention, humans are the only known reservoir of poliovirus. Polio used to be called infantile paralysis because it affected so many children. Today, polio is only found in 3 countries, and they are Nigeria, Pakistan, and Afghanistan. There are 3 different types of poliovirus, and they are subclinical, non-paralytic, and paralytic, and with each one it gets more severe. Approximately 95% of polio cases are subclinical. This is the mildest form of polio. Patients may or may not experience the symptoms of polio. This type does not affect the central nervous system. Non-paralytic polio does affect the central nervous system. However, this type produces only mild symptoms and will not result in paralysis. Paralytic is the rarest form of polio, which will produce full or partial paralysis in the patient. There are 3 types of paralytic polio. They are spinal polio, which affects the spine, bulbar polio, which affects the brainstem, and bulbar spinal polio, which will affect the brainstem and the spine.
The signs and symptoms of polio range from mild to severe dependent upon the type. The difference between a sign and symptom is that someone can see or measure the signs and only the patient can feel the symptoms. If the infected person does have symptoms, they usually last for 72 hours or less. Viruses can be carried to the central nervous system by blood supply. The signs of subclinical polio include a red throat, slight fever, and vomiting. The symptoms of an individual with subclinical polio include having a sore throat, headache, and a general discomfort. Like Brianna mentioned, this type of polio does not affect the central nervous system. Non-paralytic is a little more serious than subclinical polio. The signs include abnormal reflexes and muscle spasms. The symptoms are arm and leg pain and stiffness, muscle tenderness, back and neck pain and stiffness, problem swallowing, and fatigue. The symptoms of subclinical polio are also included in non-paralytic polio. The signs of paralytic polio include loss of reflexes, severe spasms, loose and floppy limbs, sudden paralysis, and deformed limbs. The symptoms include severe muscle pain. Patients with paralytic polio also experience all of the symptoms associated with non-paralytic polio. Full paralysis can develop, but this is very uncommon and only occurs in 1% of all polio cases. 5 to 10% of patients with full paralysis die from the attack of muscles that control breathing.
So, an example of how polio can be contracted from the fecal-oral route is from kids at daycare. Let's pretend that there is a child at daycare and he has polio. And he goes to the bathroom and he doesn't wash his hands properly, so he has feces on his hands. He then goes and plays with the other children, and they're playing with the same toys and putting their hands in their mouths. He transferred polio to them because the polio lives in his intestinal tract, and when he got feces on his hands and then they touched it and they put it in their mouth, they contracted polio from the fecal-oral route. So the other way that polio can be transmitted is from the oral route. And to give you an example of this, we're going to pretend that we're going to go on a field trip. And on this field trip, we're going to go to a restaurant. So we're eating the food and we all ordered water because we're trying to be healthy. And the food is really good, and then a few hours later, to about 72 hours for some of us, we're feeling really sick. We have aches and pains, we have a fever and a sore throat, and then the next day in the newspaper we read that that restaurant used contaminated water in to give to the customers, and they use contaminated water to wash the dishes and in their cooking. And then as time passes, we go to the doctor, and from the signs and symptoms we realize that we have contracted polio from the oral route.
There's no cure for polio, but there is a few treatments. One treatment that is very important is pain relievers due to the large discomfort that it causes for the host. Another very large treatment is physical therapy, which can help the muscles. And if respiratory failure does occur, then there would be artificial ventilation maintenance to keep the host alive. There is prevention that is available. There is the IPV, which is inactive poliovirus, as well as the OPV, oral poliovirus. The inactive poliovirus was invented by Jonas Salk in 1954. The OPV was invented by Albert Sabin in the 1960s. For prevention, there is needed at least the IPV vaccination. The United States actually used a lot of the OPV when it first became available due to its ease of use, but later changed over to only using the IPV due to the fact that the OPV actually could transmit in rare cases live virus, which in rare cases ended up polio actually attacking its hosts.
Polio, polio, polio. 1789 was the first description by Michael Underwood, a British physician. 100 years later was the first epidemic. Confused a lot of doctors that were good in academics. By 1955, polio was diminished. Jonas Salk did the work that others couldn't finish. Late 1950s, Sabin came about. It's a vaccine that you take through the mouth. A few years later, Sol vaccine was over. Sabin came through and caused a major takeover. Pittsburgh public schools got a hold of it. It was put in sugar cubes that were served in a dish. Now there's less people with their crippled fists. Polio's a disease we won't miss. We thought it would stick one day, but it's gone. Now everything's okay. Polio, 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 polio. 1916, a big outbreak started. Spread so fast, most people say it darted. President FDR got the disease. It was so serious, he needed a vaccine. People chipped in, dime by dime. Money started accumulating over lots of time. So find out that this might just work. Then something happened that was berserk. He gave the study to Pittsburgh public schools. Next we find out that we wasn't being fooled. Took the money, this wasn't even funny. He tested it on monkeys as if they was his dummies. Polio, polio. Thanks a lot to me. Thanks a lot to me. Guess what? Guess what? Fucking cure. Nah, there's a second.